We mentioned earlier that there's a lot of new terminology to learn when entering the healthcare field. I wish to take a little extra time to talk to you about movement terminology that will help you better understand patient exercises in general. We won't apply these yet to any specific exercises, but we hope to train you on these terms so that when you see them on a patient's chart or you hear them talked about, you'll feel comfortable understanding what movements we talk about to better understand the patient's exercises and activities for that day. For this portion, I'll focus on the upper half of the body, and we'll break down these movements one at a time. Please feel free to come back to this video often to review and practice your knowledge, as this will help strengthen your confidence in your ability. Starting at the neck, we have 6 different movements at the neck. First, we have cervical flexion. This is where the neck bends forward in this fashion. We have cervical extension, where the neck bends backward in this position. We also have cervical side bending, which takes place when we tilt our head to one side as if we're drawing our ear toward our shoulders. And then we also have cervical rotation to either side, where people are turning and looking as if they're looking over their shoulders, both to the left and to the right. Moving to the shoulder, we also have 6 motions at the shoulder. We have flexion, where we're lifting the arm straight out in front of us. This motion can extend to all the way to an overhead lift out in front. We have abduction, where we lift the arm away from the body and up to the sky. We also have extension, where we pull the arm back behind us. And we have adduction, where we bring the arm back down to our side or add it back to our side. We then have nuanced motions like internal and external rotation. This is when we take this upper bone in our arm called the humerus and we rotate it out or in. It can be more easily seen with our elbow bent in this fashion. As we bring the arm up like this and back toward the back wall, that is external rotation as this bone turns externally out. As we bring our arm down and back around toward the wall behind us, that is internal rotation as our upper arm rotates inward. We have 2 special movements that I haven't mentioned at the shoulder, which take into account abduction and adduction, but just in a different plane of motion. So rather than out here to the side of abduction and adduction, we have horizontal abduction and horizontal adduction. Now, to be clear, when we're lifting our arm away from our body, it's spelled abduction. When we are getting our body closer to our body, it's adduction. At the elbow, we have a few movements here. We have elbow flexion, which is bending as if we're doing like a biceps curl. And we have elbow extension, where we're straightening out our elbow. We also have some nuanced motions at the forearm, known as pronation, where we are turning our palm down toward the ground like a pro basketball player palms a basketball. Or we have supination, where we rotate the hand up as if we're curling a bowl of soup in our hand. At the wrist, we have a few motions as well. We have extension, where the backside of our hand comes upward. We have flexion, where our wrist bends down and our palm comes toward our forearm. We have radial deviation, where we tilt the wrist toward the thumb side of the hand. We have ulnar deviation, where we tilt the wrist toward the pinky side of the hand. We also have movements in our fingers. Anytime any of our joints bends toward the palm of our hand, it's known as flexion. We have flexion of our fingers. Anytime we are straightening out our knuckles in our hands or our fingers, it is extension. These are the movements that take place in the upper body that involve the things that are attached to our appendages. Now we will talk about the axial motions, or the ones that are involved in our spine. We referred to the neck before and its 6 movements. Our mid-back, our thoracic spine is what it's called, has 6 movements, and our low back, the lumbar spine, has 6 movements. These are the same 6 movements as the cervical spine. I will quickly go over them so you can see what they look like. In our mid-back, we have thoracic flexion, a rounding of the back. We also have thoracic extension, an arching of the mid-back. We then have thoracic side bend, which is where we crunch down our ribs on each side of our body, to the right and to the left. We also have thoracic rotation, where we can move at our thoracic spine as we rotate to the right and to the left. Lumbar flexion involves bending and hinging down at the hips as if we're going to reach toward the floor. Lumbar extension involves bending backward like we're looking up to see the sky. Lumbar side bend looks a lot like thoracic side bend. And lumbar rotation looks a lot like thoracic rotation. These are movements that we monitor and measure as providers, but some of these will become applicable to the exercises that we ask you to put our patients through. We ask you to take the time to review these and better understand them.